Hi Dylan, it's Dr. B from here with Mitzi. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times on the screen. Like we talked about, we examined your shoulder before we started, and there was significant instability both anterior and posterior. So we're expecting to have to tighten the ligaments both in the front and in the back of your shoulder. So this is our first look inside. To the right of this metal cannula is your biceps tendon. And we can tug on, it looks okay. Here's the biceps anchor at the tip of that gray cannula. And remember, that was one of the areas we were worried about. And this biceps anchor actually looks okay. So as we look down at it, I'm tugging on the biceps pretty hard, and you can see it's not pulling away from the bone. There's a little bit of a foramen right at the tip of the metal cannula, but that's normal. Okay. And that actually looks pretty good. So the rotator cuff tendon is at the top of the screen above the metal cannula, and that looks really good. No signs of any problems there. Hold these two cannulas in. And as we rotate the camera, look towards the bottom of the shoulder, we'll have a look at the capsule down here. And that posterior capsule is something we're going to be tightening here in just a minute. We may have to put an anchor in, depends on how stable that labrum is right on the edge there. And then as we look down anteriorly, we're going to tighten up this ligament down here below as well. So we're going to put the camera in the front, have a look from the front to the back. Okay, Dylan, so now the camera's in the front. This blue cannula is coming in the back of the shoulder, and this gray cannula is coming in the front also. And so now what we're doing is we're looking towards the bottom of the shoulder. So if we were standing or talking about this as a clock, 12 o'clock would be up here, this would be 9 o'clock, 6 o'clock would be down here. So we're looking from top to bottom. Now this is the posterior band of the inferior glenohumeral ligament, right where I'm touching. And this is something that we'd like to tighten up here to try and stabilize the shoulder a bit more. Your instability was actually more towards the front once we had you under anesthesia, but you had a definite posterior component to it. So as I tug on the labrum here, this actually feels pretty stable. So I think we'll be able to use that as an anchor. So the next step is to go ahead and take an instrument called a rasp, which is this instrument here. And what this does is it just roughens up the soft tissues. Basically what we're trying to do is make this like a piece of Velcro so it'll stick. Let's see if I can't focus a little bit better. So you can see the ridges on it. We'll go ahead and roughen up here. And then the main instrument that we're going to be using to pass our sutures is called the suture hook. Here's the hook. It's what we call a turn to the right hook. It's loaded with a black wire that you see there called a super shuttle. And we're going to start down low, right about here. So we get a bite of this posterior capsule here. Then we'll come back and come underneath the labrum. There. inside your shoulder, we're going to load that with a suture. Now we're going to do a particular type of stitch. This is called a figure of 8 stitch. And you'll see what that looks like in just a second here. Hold the camera, please. So now we've got half of that done. We're going to go ahead and reach in and get the suture limb in the back again, just like that. And now we're going to use that same suture hook. Give me a grasp, please. That same suture hook to pass another stitch. Start here. Here. Okay, we'll show you some more in just a minute. Okay, so now we've passed that one stitch twice, and we're getting the partner suture here. We're going to go ahead and tie a knot here. You can see how that creates kind of an 8 or a cross, which is why it's got that name. So now we're going to tie what we call a non-sliding knot. Half hitch and then we're finished with this knot. Okay, and so now we'll cut the suture tails here. And that's the first part of the repair. So what that's done, hopefully, looks like it has, it's tightened this posterior part of the shoulder, and the rest of our work is really going to be in the anterior portion of the shoulder. Okay, pause please. Let's go ahead and... Okay, now we're looking at the front of the shoulder. We've already roughened up the capsule a bit. It's interesting in that it doesn't really, on the face of it, look that loose, but it certainly was clinically, and that's why we're going to tighten this ligament here. We're going to reach in with our hook and make a pass through about here. get it down and through and show you some more in just a minute. Okay, you can see we've got the first stitch passed. And now, just like we did in the back, we're going to do a figure 8. So we're going to take this anterior suture and bring it posterior. And then we're going to take our suture hook. And make a second stitch somewhere in this region here. Okay, so we'll retrieve that and load it and show you some more in a minute. Pause, please. Okay, so we've passed the second limb. You can see it coming across right there. And now we're going to get this stitch. And the next step is just like before. We're going to tie a knot. Pause, please. Okay, so we're just finishing up this knot here. There it is there. Good. So now let's look inside the joint, and you can see we've got two kind of evenly spaced sutures, basically one at 5 o'clock, one at 7 o'clock, and it's really tightened down the inferior recess, which is what we wanted. That ligament's the one that's really important for shoulder stability, the one at the bottom that runs between 5 and 7 o'clock. What I'm trying to decide now, Dylan, is if we have to do anything else. Back here, this looks good. Don't see any significant problems here. Hold this, and then as we look down the front, that looks pretty good. I'll tell you what we're going to do. We're going to put in the shaver, and then we're going to put the camera in the back one more time. Possibly. So now we're looking from the back to the front again. Rotate me down to 9 o'clock, please. And as we look down the front, first of all, it's hard to see down the back, which is good. That's what we want. In the front, you can just see that stitch that we put in. And then here, this tendon here is called the subscapularis, and that looks fine. I don't think there's anything else we need to worry about. It looks like that labrum's back where it needs to be. Now let's look one more time at the biceps anchor. Rotating back around. And I'll tell you, that anchor is going to be okay. A little sublabral frame in here, but we know that's normal. Back here, the anchor looks okay. So I'm going to leave that alone, I think. We'll clean up a little bit more, but then we're going to get you back to the recovery room. So I really hope this does the trick for you, okay? Good luck to you now. Bye-bye.